Welcome back to Starting with IEP. I'm your host, Flor Amelia, and today's episode is one that I've been wanting to record for so long. And it's because it speaks directly to something that so many of us parents that we have experienced, but rarely we feel safe saying it out loud. And don't I know it? I don't know if I told you, but it was actually because of an admin that told me to stay in my lane that I became a classroom teacher, even though I already finished with my first master's in applied behavior analysis. But because that admin really did not want me in that room, or really did not want me to advocate for my daughter's IEP, I remember there was this other admin that basically told me to shut up. I was asking too many questions, but I didn't understand the IEP. I want to say for a really long time in the beginning of the journey, I was very intimidated, but I also have found so many professionals that were willing to show me and understand. My daughter's case was actually, and it still is, pretty complicated because with 5 brain surgeries, she was diagnosed with intractable epilepsy, intellectual disability, autism, expressive aphasia, traumatic brain injury. There's actually so many more diagnoses that her case has been complicated to speak in IEP meetings. And I remember it was in kindergarten that they were saying the reason why she isn't progressing is due to all of her seizures, but because she has epilepsy, that's why she's unable to make progress. She was having like hundreds of seizures a day. So I understand why they assumed, but they didn't know that I was also collecting my own data at home. Actually, you guys, I was actually going through it. Oh my goodness, I'm actually so excited. Okay, don't laugh. So these are one of the books. Sorry, it's like upside down. These are my handwritings. And I took note each day I was writing what she was doing, what she was not doing, because yes, I understood. And I was afraid of regression for my daughter as well. So I've asked so many questions. Actually, we'll talk about note taking and progress taking another day with a different episode. But I want to say that I've been intimidated by admin so many times that, well, that's one of the reasons why I am where I am today and why I want to do this, because I want to make sure that the families out there know that you guys can advocate for your child. It is okay. You're your child's best advocate. You know your child best. So please don't feel intimidated. If you're in the IEP table, don't feel intimidated by them. They just need to know how to work with us parents. They need to see us as part of the team. And with time, they will. The more that you know, the more that they will understand that you really are part of the team. Hopefully with time, they will know. I want to say that admin still makes me feel uncomfortable, but that's okay. Just know with time, and once you know more, they will think twice before saying things that are a little mean. But I do want you guys to question if you have ever felt in that IEP meeting like we or me or you were part of the problem because we were asking questions. I don't know about you guys, but whenever I felt like I was finally advocating for my child, they quickly saw me as being that parent that is being a little bit too much. Or maybe you've been told a little bit too early, like we have, and you'll hear the story during the interview, what your child won't be able to do without enough data, time, or collaboration. Now, I want to say I did understand, and I was okay with Aaliyah's medical team telling me that because it had to do with the prognosis, right? They were getting me ready for that. But every child is different. So please don't let their assumptions, don't let what they anticipate for your child become your reality or your child's reality. Really, progress for your child really depends on the team. Depends on that collaboration, depends on how data is being taken, which is why today I am joined by Michael, a veteran special education administrator with over 35 years of experience. He is someone who has served as a teacher, school leader, and even worked at the Maryland State Department of Education, which he will definitely talk about more during the interview. But most importantly, Michael definitely understands what true partnerships between schools and families should look like. Well, in this conversation, what we're going to be unpacking is how decisions like retention, diploma versus certificate track, and placement should actually be made, why parents do have a voice even when schools disagree, how past IEP trauma impacts family, and what strong, respectful school leadership really looks like when students are at the center. This episode is honest, emotional, and incredibly validating for parents who have ever felt dismissed. It also empowers anyone who wants to advocate without burning bridges. So that's also important. Try not to burn your bridge. Before we dive in, make sure to follow the podcast, like this episode, and share with another parent who needs to hear this. You can also find support resources and our courses at www.startingwithiep.com. Now, let's get started. Okay, I'm super excited. This is actually a conversation that I wanted to have for, I think it's been over a month. And I think from the very first time that I spoke with you, the first time that we met virtually, it was so great to meet someone that understood. And I'm like, oh my goodness, he's getting it. And I think I told you, I was like, I think I love you because of everything that you were saying. It was hard for me to hear everything that you were telling me because I wasn't used to hearing that. I'm so excited. Thank you so much, Michael, for you to come and for you to share your insights with all the other families. Because a lot of times I feel that maybe I am too much of that parent. And sometimes I say too much to the staff or to admin, and I feel like I'm the black sheep a lot of the times, but I feel like once we hear from you and then we as the families can learn how to have a better relationship. Because I want to say a lot of the times the admin wants to have a really good relationship with the family as well, just like the family wants to have a good relationship with admin. But please, Michael, I feel like I would not do justice to all of your experience. I admire you so much. I respect you so much. So if you can please give us more of your background so everyone else can also know everything that you have done.
Sure. Thank you for having me, Flor. I appreciate it. And I share that sentiment too. When I first met you, I realized that as someone that I'm really aligned with in what we believe and how we work for students with disabilities. I have been in the special education field for 35 years as an administrator, as a teacher, running schools, running programs. I also worked for Maryland State Department of Education in the assessment division, and I was part of the team that built the MCAP assessment that students take in Maryland, as well as part of the DLM group who brought DLM to the state of Maryland for students with disabilities. My background is huge in that space, but I'm really delighted to be here to talk to you.
Thank you. Thank you so much. Yes. And I think it was the third time we met. And I was telling you about certificate track versus diploma track. And I told you the horror story that I guess it was really gut punching when the neurologist told me that most likely my daughter won't go to college. And that was too early. That was just too early for me, for the neurologist to tell me. But
When
he
was
did.
that? What grade was she in?
Oh no, she wasn't even in kindergarten.
Okay.
This was when they were telling me the Lennox-Gastaut syndrome. So this was around age 3, but I've heard it. I've heard it when they told me infantile spasms when she was diagnosed at 14 months. The likelihood of her going to college wasn't looking good. Even the likelihood of her driving. This is how early they were telling me. And when she was 18 months old, we got the letter saying that she was moderately to severely intellectually disabled. That one was hard. But I've always grasped onto the stories that I saw on YouTube. YouTube was still big back then. And I would put infantile spasms, and then I would follow these beautiful stories how they did go to college, how they were able to go to trade school. It was great stories. So I really latched onto those. But then it was around preschool going on to kindergarten that they told me that Aaliyah wasn't going to be on the diploma track. And I was really confused. And my gut told me, don't let them, because I was like, Aaliyah can be one of those good stories. Maybe she can eventually, once we stop these seizures, because we were on this fight trying to stop these seizures, maybe we can make it happen. So, one of my first questions that for me it's really important is, how does the IEP team determine whether grade retention is appropriate?
That's a great question. We all know there's multiple LEAs in the state of Maryland, so they are governed individually per county. So each county has specific guidelines that they follow. Some have the same, some are very different. But the basis of retention is because the student is not progressing or not getting the academic knowledge that they need at that grade level. For a student with an IEP, the IEP determines whether that retention is necessary. And there's a lot of information that they use, the data that's collected throughout the course of the school year. It should all be looked at before any decisions made by the team. But it's not an automatic decision that say they fail a test. That's not how that's done. The IEP team, the group that does make the decision to retain or not to retain a student. Parents need to be involved in that decision, obviously. Parents have a huge voice in that decision. And sometimes, as you were talking in your intro, administrations of schools want to have a great relationship with parents. This discussion should not just be a curveball to the parents. Most of the LEAs follow the same guidelines, which in the third quarter of that year, it should be discussed. So if there is an issue and your child
Hmm.
is not really retaining what they need to retain to move forward, then that discussion should be put on the table way in advance for everyone to
Hmm.
talk about it, to look at the data, to make a really wise decision in what to do and what not to do.
Yes, I apologize. I should have mentioned this part. I knew that there was something wrong. They knew there was something wrong. It was like a curveball for the parent. And when they told me this, the reason why they wanted to put her on certificate track, immediately I was like, no, we're going to repeat the school year. We're going to repeat the school year. If you're telling me that she's not where her peers are, this little girl has been hospitalized so many times. She missed so many days of school. I was like, maybe if we would just repeat kindergarten, maybe she can catch up to her peers. They were not expecting for me to suggest for her to be kept back into kindergarten. They just expected me to accept the whole change in certificate track or diploma track. So thank you so much for allowing me as a parent to hear that, because I'm like, I wish I would have heard that when I was younger because no one ever gave me information.
Well, COMAR, it's in the state regulations. A change from diploma to certificate track can take a long time. You don't have to make a decision until the student potentially could be in high school. That's what the law says. The answer would be no. We're not going to move to certificate track. We're going to stay on a diploma track and gather more data as in your instance, as your child was getting more skills and learning more things to build up their academic portfolio into moving forward. The school does not have the oversight to just move someone into a certificate track. They just don't. So now, cognitively, there are benchmarks, and
Mhm.
I'm sure you understand when your daughter was diagnosed, there's realities with cognitive levels. You make that decision, but you also need to give the student time to build their skills. And I've seen students who have struggled initially, but have moved forward
The right
slowly,
supports. Hmm.
not like their typical peers, but they've moved forward slowly and they picked up the skills along the way with all the interventions that are put into place within the IEP. So, can that happen through it? Yes, it can. But again, going back to cognitive levels and things like that, there's a certain window that you know, or you're preparing yourself that maybe you may not get out of. But making that decision that early, as
Hmm.
an administrator, I would never entertain that decision. And I've seen cases where running schools where kids were referred into the school and they were already on certificate track. And that would be the first question in the IEP meeting. Why did this happen? What data did you have for a kindergarten kid that you could really make this decision? There's some really clear cut decisions that you can make, obviously, but there's a lot that are just really gray. And if it's gray, let them progress forward and give them
Hmm.
time.
Yes. Oh,
But it's
I
not a
love.
definitive no, and you have a voice in that decision. If you say no, then the school can go back and forth, and you obviously don't ever want to get to arbitration or things like that where you both disagree and you have
Yeah.
to go in front of someone to make a decision. But a good administrator would not let that go forward like that. They would work with the family to give the student time to build their skill set. That's the
No.
appropriate thing to do.
Yeah, thank you for reminding us if there's gray areas to really advocate at that time. I have two kindergarteners right now.
You're busy.
Yes, I have five kiddos, and out of the
Mm.
five kiddos, two of them are kindergarteners. One of them we held back. She was in private school, and socially, she was not ready to go to first grade. So we went from private school to public school so that way she can do the language immersion because she did understand academically. She was where she's supposed to be, but we knew that socially it was hard for her. So we put her in the public school for the language immersion program where her curriculum would be in Spanish. And so she's learning Spanish. Now we have another kindergartner. And it's the same thing, but a lot of it has to do because the month that they were born in was the cutoff age to be
Mhm.
entering in. So my 5-year-old, he's like the youngest 5-year-old, and in his class, there's 6-year-olds going on to 7, from what we found out. And I guess because parents are holding back their kids if they're not socially ready or academically ready. And I gotta tell you something, all of our kids are different, right? But I took my 5-year-old to a birthday party because he was invited. The whole group, all the kids, they were playing soccer. And my son was behind me, and I was like, oh no, Sean should have dropped him off because maybe he would feel more comfortable if dad or if his brother was there. But he was crying and then he ran to the bathroom. So Sean was describing, like, oh, it must be social anxiety because he has felt social anxiety before. But I've never seen it. I've heard what the teacher said, my other kindergartner. I've never seen it with her. She would just be shy and she would be with the group, but she would be really quiet. He was scared. So we spoke, said, we're going to play soccer while everyone plays kickball. And then I was able to get another kid to join. So it was a small group, and then he was more comfortable. And then we went to a bigger group. He was really afraid of the bigger group. So, yes, I called Sean and I called the big brother. And then they were making it more helpful for him to want to join. But
Sure.
that's when it hit me. I knew that other families, they were worried, but I was like, I need 6 play dates every day. I was like, I need to really immerse him with these social groups. And the reason why I was telling you this is because I wanted to see about other families that are in public schools. Because when I spoke to other kindergarten moms, they told me that in public schools, you can't easily hold them back,
Mhm.
especially when it comes to social reasons. It's not enough because academically they're fine. They have to keep on going. So my question would be what factors should carry the most weight, like academic data, emotional maturity, which is the social part piece in there, the parent input, or team consensus?
That is a really great question. The interesting part, a lot of private schools actually, their programs are built around an additional grade. So it's kindergarten plus. A lot already have that built in that kids are not ready to move forward. So they keep them back a year. But again, in private school, you're paying for that. And it's more acceptable to do it that way and easy to do it that way because you're under a different set of guidelines. But all those things should be taken in consideration. If a student is academically with their peers, again, everyone points to that always. But in making the overall decision, remember these are individuals. Okay, you can't just make it for a group. So we're taking for granted that the student already has an IEP or working toward or has been diagnosed with a disability. So, with that said, then that is a very individualistic decision to be made for that student. And all those factors need to play a role into the decision that is made. And again, it depends on the school, it depends on the administration and where they fall. My background, I started out working with infants and toddlers, so I understand that early intervention piece
Mm-hmm.
of education. Some folks who run schools don't have that background. So, with that background,
Mm-hmm.
understanding that story that you told would be a key part of the decision that is made. So, emotional maturity is something that should be taken into consideration. And again, making a decision like that should not be a curveball. This should be an ongoing discussion in that year. And by the time you get to the third quarter or the end of the school year, you'll have enough information to make a really refined decision. But what I've seen, which is not a good thing, is at the end of the school year, you're called in and it's, oh, by the way, this is what we're doing or this is what we're not doing. And that's just not a way to do it. That's just not how things should be done. Parents should be part of that discussion throughout the entire time. And if you have a teacher who communicates throughout the whole year, you will know where you are as you move through. It's
Yeah.
just like an employee. You can't just go to an employee and say, oh, by the way, you're doing something wrong. We don't need you anymore. That's the bad way to do it. It's that there's something that's not being done correctly. You educate them and say, hey, this is not working. We're going to try to work on this. And you put into interventions to help support that person throughout the whole process until you have enough information to really make a great decision. But parents, again, have a
Yeah.
voice. And sometimes parents forget that they have a really loud voice. Not loud, like they don't have to scream it, but a loud voice. It's a powerful
Has
voice.
a lot of weight.
Sure, they need to take advantage of that. And that's a good thing. That's not a bad thing.
Oh, thank you. That's exactly what you said last time. So thank you for letting families know that it's not a bad thing. But a lot of the times, if we start this early on, we're just talking about the kindergarten stage. Sometimes we
Sure.
feel bad. We're just in kindergarten. Imagine high school.
But you start your advocacy at that point. Parents are advocates.
Yeah.
I never walked into a relationship with a parent and looked at them as a foe. I looked at them as parents of a student who has come to the school to be educated. You are a partner. That's how this should be. This is a partnership. We are partners. You have a role. I have a role. The school has a role. The teacher has a role. If we each do our role, then we'll have a successful relationship.
Mhm.
Okay. It's like marriage. Every marriage, you have two people. Okay. And it's not always perfect. You have to work out kinks, different things people like, what they don't like. And you have to listen and you have to communicate. And that's respectful.
Yes.
And once you start that partnership, and if you start it on that basis, then when you do have issues that come up, you can sit and communicate your concern in a respectful way, and it's received in a respectful way. Okay.
Mhm.
But it has to be built on partnerships. A lot of times schools don't do that. And that's unfortunate. As
Yeah.
someone who has ran multiple schools, it's a strong word, but I would demand that staff be respectful and always talk about how this partnership benefits not just the parent or the school, but who does it benefit most? The student. And that's the key part. The student is the focus, not my feelings.
Yeah.
Your feelings are there, but how it affects the child is the most important thing. And as adults,
Yes.
we have to get past the emotion, past
Oh, yeah.
sometimes getting angry, sometimes getting frustrated to do what's best for the student always.
Yeah. Yes. And I think I've shared with you this one story, but I don't think I've shared with people listening. I loved how you said that. I love how you shared that. And I think for me, it's like the past trauma for IEP meetings that it puts a guard up for me for future IEP. I was like, oh, I'm not going to be, not again. But I do understand if for example, I've had histories with a certain speech pathologist in my daughter's team that for some reason, every single time I talked for years in the IEP meeting, she would roll her eyes. But I knew that my daughter loves her, still loves her. So I would be like, maybe if I have something to say, it must annoy her. I don't know. But my daughter loves her. So I just swallowed it. I didn't mention it. I didn't get upset. I didn't speak up saying, can you please stop doing that? It makes me feel uncomfortable. I'm like, my daughter loves her and she makes my daughter feel comfortable. Now, past 3 years later, she still does it. My team, when they come and they see her act that way, it makes them uncomfortable. So then I did point it out. And then when I point things out as a parent, my mental emotional health is not great because these are years of me letting it go and I don't like confrontations, but I was protecting my mental health and I didn't want to talk to that person. I want to talk to the supervisor, but then they all assumed that I was being rude. And that was just my way of just really trying to put this up. And
Mm-hmm.
then the admin needed to protect the staff. And I was like, years, and there's documented that I have shared this, but that was like really the first time that I was like, this school is not a good environment. It's like a toxic environment. Maybe it's a work toxic culture there. And I think at that time, I just didn't feel like I was part of the IEP team. And I typically want to say I do feel it, but I've been disrespected several times by admin because they don't have a lot of families like me that question data or question how things are being collected.
There's a couple things.
Yes.
Okay. So
Thank you.
let's step back to the first time. So you can't obviously change this, but
Mm-mm.
what should have happened, again, a large part of my career was spent at the Maryland School working with kids who are blind, visually impaired, deaf, hard of hearing, deaf, blind. It really involves medically fragile students. We had a large groups
Oh,
of people on the IEP team, some upwards to
mm-hmm.
15 sometimes. So where it starts is from the beginning. The person who is chairing that meeting is the person who is responsible for the flow and the communication flow. That person has to be aware of things like this. And as someone who has chaired hundreds of IEPs in all these years, one of the things I always paid attention to were body language from all the participants, especially the parents. Okay. And something like that could easily alleviated a lot of your stress if someone picked that up and said, oh, I'm noticing this. And then talking to that person and saying, hey, it may not be an intentional thing, it may be an unintentional thing, but it's happening and we need it
Mm-hmm.
not to happen. And that's a really easy discussion to have. If it is an intentional thing, then obviously that's a staff issue that the administrators would have to work with that person because that's not the appropriate way to present as a representative of that school. It's just not professional. Okay. So it could easily have been handled if someone picked it up and was really paying attention to that. But body language is really key within an IEP because
Yeah.
it's an emotional process. It is. It truly is.
Yeah.
And if you go into it, I always went into these meetings knowing that there would be emotion. And I would talk about it. It's like, this is going to be a tough meeting. So we need to really
Thank
pull
you.
together as a team. And when it comes time that there are emotions, we're going to take a minute, take a breath. If we have to take a break, we will. But we get through it together because this is a team. Okay. It's not just us versus them.
Mm.
Because remember, the us has a middle, and the middle is the student. So
Thank you.
getting to that point of being so frustrated, that's a lot of times where what parents feel that they get a reputation of being the tough parent or the problematic parent. Okay. And I would have staff come to me and say, this parent keeps asking for this, and this. And yes, they are. Why? Because they have a child with disabilities. It is an emotional thing. You have to take yourself out of yourself, put
Mm-hmm.
yourself in their self, and come from their perspective of what they're looking at and what they're seeing. And if you do that, then you'll see their perspective and why they're feeling that way. So we meet the parents where they are, okay? But it has to be respectful. You have to do it the right way. Getting to that point of frustration, as I said, is not a good thing, but now we're there. We have to hit it head on and have an adult conversation about that in the meeting and say, these are the norms of the meeting, and this is what occurs. This is what does not occur for parents as well as staff. I've had that conversation multiple times where parents got really upset, staff got really upset, and I've had to talk to both of them and have adult conversations,
Mm-hmm.
trying to do that privately for the most part, but sometimes within a meeting where people are going back and forth. But if you're really doing it the right way
Yeah.
and you're running an IEP as the chair, or you have an administrator, and as an administrator, I've sat in IEPs and I wasn't the chair, and I let the chair, they're responsible for the meeting. I wouldn't jump up and say, hey, stop or do this because I am the person running the school. That's their job. I would not
Mm-hmm.
intervene unless it was truly something I'd had to intervene on. But at that point, you have to have the chair of the IEP really take charge and run the meeting appropriately the way it should be run. And it is run in a team with team
Collaborative
communication
approach. Yeah.
with norms. And the norms should be addressed before you start every meeting. That's the right way to do it. That happens all the time, and it should not happen. Parents with a voice should not be labeled, they're the problem. No,
Oh,
you're the advocate, you're the parent. Okay.
yeah.
Now, there are some parents that go a little off kilter that, again, you stop, you take a break, and you pull them outside and say, listen, I
That would have been
understand
good.
it's
Mm-hmm.
emotional, but we can't raise our voice. We
Mm-hmm.
can't swear. We
Oh
can't
no.
bang the table. We can't do any of these things. If we do those things, then I'll stop the meeting and we'll reconvene when you feel that you're up to doing it again. And I've done that too. And I've had to
Mm-hmm.
do it. Not
It's
often, but I have.
it's yeah, those meetings are so emotional, and a lot of the times I have to say behavior is not spontaneous. Why is the parent so uncomfortable in these meetings? I've sat in so many IEP meetings that you can see the parent from the very get-go very emotional, or sometimes they feel like they can't speak because if even one person is there that intimidates, and often I've been hearing it's the principal that it's intimidating the family or whichever provider that they're trying to ask to change. I don't know if I mentioned this one to you yet, but about the speech pathologist. In the IEP, it didn't say if it was going to be one-to-one, like speech language service, or it was going to be in a group setting. But she told mom that she couldn't do the one-to-one because she didn't have enough time for her lunch. So mom was
You told me that. Yeah, I
yeah, oh
remember.
yeah, I did tell you
Yeah,
that. So it
yeah.
was, but the mom was so afraid of speaking up because she said, "Oh, you don't want me to have my lunch?" And then she was like, "No, I
Mhm,
do. Calm down." She
mhm.
told the speech pathologist to calm down, that she wasn't asking her to take away her lunch. So when the IEP meeting came, the lady was like livid, and all mom was asking for is my child needs the one-to-one because that's what it was said in the previous IEP meeting, but nothing was written. But all these moms that I've been to, there's more moms than dads that I've been going to these meetings, but I completely understand when they feel uncomfortable because, again, behavior is not spontaneous because their reaction or how they're acting is because of a previous experience. So once they have
Mhm.
more positive IEP meetings, once they have more experience of that, then they don't have to respond in such a way that they're nervous or they're afraid. It may be seen like they're rude. They're just not. They're just scared or
They're
uncomfortable.
scared. And sometimes they're parents like yourself who are actually professionals in the field. And a smart administrator, when they enroll one of your kids, knows who you are, knows your background, and knows that, oh, the parent coming to the IEP is also a licensed special educator, a licensed BCBA, and your focus may be from those
On
two
data.
fields.
Hmm.
Okay, so if the expectation is, I know you're a BCBA, you're going to ask me data driven questions. That's just BCBAs. You like charts, you like data, you like all that fun stuff. That's homework you have to do before you even start anything. Okay. And once you know who's on the team and where you're coming from, you have a better perspective of what kind of questions you're going to ask before you even get into a team. Okay.
Hmm.
Something like that could have been really easily handled. Communication should be happening with each of the providers
Yeah.
continuously. Okay. And
Yes.
I always made sure that our related service and our teachers communicate to parents, give them feedback, answer questions, have communication. And that could have easily been discussed. Wait a minute, our IEP discussion, because it's in the prior written notice, says it's a one-to-one service,
Yeah. And it
but it's
wasn't
not
there.
happening. Can you explain to me? I'm curious why it's not happening. See, I always enter into these conversations by being curious. Instead of being point the finger, I'm curious. How
I
come we're
love
not
that.
doing one to
Okay, you
one?
guys heard it. Always word. I'm curious.
Correct. Instead of, you didn't do this. Why?
I'm curious
I'm curious. Can you explain to me why we're not doing one to one? Because
because
that's what
it's,
it has in the IEP, because I see it on page 5, the prior written notice. Oh, then there
yeah.
could be a logical explanation, but not getting a lunch is not a logical explanation.
Hmm.
So that's the wrong response. But again, communication. These situations could have been handled if there was better communication.
Yeah.
And just because the meeting's over, the chair of the IEP is still responsible to make sure that those teams are working for your student, for your child. Okay,
Hmm.
so once you're done the meeting, all the things that are requested, that person needs to follow up with each of those people and say, hey, we said we're going to do group, or we're going to one to one, or we're going to add 3 more service hours into PT or whatever. That chair needs to go back and make sure that those things are happening or put into place.
Yeah.
Okay, because a lot of times the administrator or the head of school,
Hmm.
the principal, is not sitting in the room and they're not aware of this. Okay,
Yeah.
and if it's not happening, then the chair goes to the principal and says, listen, we discussed this, we made a decision, but it's not happening. That's when the administrator steps in and says, I'm curious, why aren't we providing one to one service for this child? That's how the conversation should go.
Yeah. Now the mom knows the importance of a PWN because how the
Mhm.
school hit her back was that it's not in the PWN. But mom is like, I remember it being there. So now she knows about the prior written notice, PWN, that after that IEP, she was like, I need to have it. And she is now going to review it to make sure, even though she's telling them, please add it, she needs to double check and make sure that they're adding it
Sure, before they
accurately.
close the IEP, that's an easy thing. As you're going with these decisions, we're adding 2 hours of speech services. The speech pathologist says that in the meeting, everyone agrees. The parent should turn to the
Hmm.
chair and say, that's going to be included in the PWN, and we'll review all these decisions made before you close the IEP. Boom,
Yes.
done. And
Yeah.
it solves all. I would have a list as a chair of an IEP meeting. Any decision made, I would have a pad of paper and I would have a list of all the
Hmm.
decisions. At the end of the meeting, I would say, just for everyone's consumption, these are the decisions that we made. Number one, this. Number two, this. Number three, this. Oh, wait a minute. We had to add this to number three. Number four, this. Number five, this. Did I capture everything? Yes. PWN, everyone agrees, it's done. But a good chair should summarize it after
Yes. Yes. Parents take
Let me
note.
put it that way.
Yes. Thank you so much. There's like a series of questions that I was going to ask you, but I'm going to come back to the grade repetition
Okay.
because the reason why I have to come back to that one is because there's so many families that are coming in with the diagnoses. A lot of the families that I'm talking to, they just have to pay a private psychologist to do the diagnosis, right? I want to say the awareness was not out there. So the diagnoses would be later on. Now that they're much more, not that they're much more accessible, but now there's more awareness of it, families are getting their kids diagnosed at a much earlier age. So, one of the things that I've noticed is that more families are knowing more about dyslexia or speech delay or autism. So, can you please tell me when parents want retention, resist, how can that disagreement be handled respectfully?
Well, to go back to your summary of this question, a lot of parents are moving into a private realm to get a diagnosis. The fact that no one talks about, schools don't like that. Schools want to be able to diagnose the student themselves, or the county wants to diagnose themselves. So when a parent comes in with a diagnosis without county involvement, sometimes that is looked at in a really weird way. It shouldn't be, but it is. But again, parents have resources, and if the county just doesn't do it, I understand why parents do it. So when they have a conflict, it is from a reputable person, a licensed person. That information has to be considered when making a decision. Schools will push back a lot because, again, every time you have to add service costs money. But again, this discussion should be about the child. And
Hmm.
if it's documented that this is what the child needs and you push hard enough, then most of the time, the counties, the schools will provide what you need. When it doesn't get to that point, then there's things that you can do and go forward with arbitration and things like that can get decisions rendered on behalf of the student. But if you're enrolling a student in a school and you're starting off a relationship with a family in a negative way by no, 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 that's again a bad way of starting off a relationship. As an administrator, I would take the time to sit and try to figure out a solution rather than a block. Because again, if you're in a public setting, we're required to provide services. I just can't arbitrarily say, no, we're not going to do that. You're required to. So having that battle back and forth, I've seen it. It shouldn't be, but it does happen because it is an outside voice that's coming in and saying, hey, the student needs this versus their internal people saying it. Okay. I would get the outside voice and the internal, say it's speech services, and the internal speech department to talk and have them talk.
Hmm.
And this professional talks to this professional. And once they both talk and they share information, it's better if you get both people on the same page and then they both can come in and say, yep, this is what we need to do. But if you
Yes.
just come from this perspective and you're trying to knock on the door, it may be problem. So in that instance, I would say, hey, let our speech pathologist talk to your speech pathologist, let them talk and come to some conclusions and go from there.
Yes. I'm just thinking about like the families that cannot afford a private psychologist to do
Mhm.
the diagnoses. I have families telling me because I'm like, oh, I want to collaborate with the speech pathologist. And then they would say they have to pay an extra amount for the speech pathologist to talk to me. So I understand that there might be financial barriers. Sometimes I want to talk to a neurologist, but I would understand because I'm like, wait, what's going on? But even for some neurologists, they would give me the time to understand more as the
Mhm.
provider. But then it's just hard for teams to get together. So in that case, what would be the solution there if they don't have a private speech pathologist or an OT or a special ed tutor? What would be the solution there if the family doesn't have that team? How can they still get the school to understand?
That's a tough one. Without something documented, it's hard to provide something for that student. So, in that instance, you may
Something
have to move forward. And what you can do is request specific data to be collected
good.
in
Hmm.
situations within the academic day to then make determinations. And most schools are good at taking data. So
Hmm.
if you set it up where this is what we want collected in these situations, and then again come back to it within a couple weeks or a quarter, and then you have some situational data, then that could spark, wow, this looks like we need to do something and we need to have someone intervene here with an assessment or things like that. But a lot of times that's where it starts, and
Yeah.
then you move into the traditional, okay, we do need an assessment to figure out what possibly the issues would be.
That's great. Typically, I tell parents, okay, I want you to videotape what you're seeing at home, how they're responding to the certain, it could be anything really. If it's social that they're worried about, or if it's at the academic, the reading, the math, I want them to video record and then kindly ask them, can I see what's going on over there? And then they can compare notes, like why is in different environments, why are we seeing things differently?
Sure, the term in the school is progress monitoring. They should be monitoring the
Mhm.
progress. That also can be done at home, exactly as you
As,
said. It could be home progress monitoring. Your videotape, I'm sure you have 5 kids, you work with your kids on different things, academically, socially, in the evening, you and your husband, and you could document stuff. Okay, so there's your set of data. Okay, and then the school has their progress monitoring, and then you come together and you look at both and say, oh, guess what? Both situations, they're similar or they're different, or this is what happened at this time, this is what happened at this time. Wow. But there's two sets of data that you can look at, and they're both
yes.
powerful and they're both done the same way. They're not a standardized assessment where you have a very specific criteria. It's just a lot of anecdotal information that you are documenting along the way as the student is learning different information.
Thank you so much for that. There was something that you said before about a good team. They will let you know how your child is progressing throughout the year. I love the teacher conferences for my daughter that's going on the Spanish immersion learning program. I don't know if the other parents are doing this too, but I did go. I asked for it to be virtual because of the only time slot that was left. But I remember in that meeting, she was just so concerned about my daughter. I was concerned too, but she was like, she's a loner. And I'm like, wait, wait, wait. Are we talking about Evelyn? I was saying her full name because not all my kids look like me. So I'm like, are we sure we're talking about her? Because from what my observations were, that I know she's quiet, but I know that she follows the girls that she feels comfortable with. She was like,
Mm-hmm.
no, she just wants to just draw when there's group activities. And that broke my heart. So those meetings, those opportunities that teachers give you, please, parents, please take them. And then there's this for my son and the other one, I was telling her, I know this is probably too early, but I'm nervous about dyslexia for my other kindergartner. And she was like, I can see. And then she was showing me, this was during the teacher conference, but from that first teacher conference, she's been giving me so many regular reports, giving me regular emails about my concerns with him being like social groups or his reading. And now she's sending me an email about speech delay. And I was like, yes, I took him to Child Find, and they said that we're doing so great at home. They see the speech delay, they understand why he has speech therapy, but they're not seeing it a need right now because he's still doing well. But now she's worried about it and she wants us to do more speech therapy. And the reason why I'm bringing all this up is because I want to ask you, what mistakes do teams make when they dismiss retention discussions too quickly? I feel very fortunate that I have my kids' teachers telling me what they're seeing, their concerns that they're seeing. The classroom can be so big, right? The classroom teacher, many students, and it's hard for them to keep up with data or to really see a child. I remember I was like, oh, Aaliyah's going to fall through the cracks because she's so quiet.
Mm-hmm.
You will only see those that are with other different behaviors. But yes, can you please tell me?
I wanted to go back to the one thing that you said in regards to when you're talking with your child's teacher. Okay, as an administrator, there's tools that you can use to better communicate. A lot of the schools that I was involved with, we used a tool, Class Dojo. I don't know if you're
Mhm.
familiar with it. It's an app. Okay, so it's instant communication. Evelyn had a great day. Evelyn did this. Evelyn did. It's instant to your phone. You see it. There's communication.
Yeah.
Teachers are busy. They are.
Yeah.
So if you know that and teachers are busy, they have a caseload, especially special educators as being one, you have a caseload, you have to do IEPs, you have to do all these different things, a lot of data, a lot of reporting. But if you have that communication with the parent and the teacher from the beginning and say, hey, all I
I'm
need
listening.
is every other day email or an every other day text, or at the end of the week, summarize Evelyn's week, then there's your data that you're compiling throughout, and it's fluid and it's in real time. So you set that up ahead of time, then when we get to bigger meetings, you will have more information to make decisions. What mistakes did teams make? They could put the child in jeopardy, truly,
Yeah.
and put them behind the eight ball by moving them too fast without the skills needed to really be successful. If you go back to rule number one, why is the student in the program? Why is the student have an IEP, or why is the student getting these services? Is because they're needed. And if you go from that perspective, that the student is the focus of all these decisions, then making rash decisions or just making them because time frame says you have to make them, that's the wrong way to do it. And you really could put that child in a position to not be successful if they do move forward without the skill set that truly they need to be successful. Okay. And as an administrator, that's a risk. A lot of times I would not take that risk. I would do what's in the best interest of the kid all
Mm-hmm.
the time.
Yes.
Okay. And sometimes those decisions are not popular decisions. But when you're in a position and you're in a leadership position, sometimes you have to say no. Sometimes you have to say yes. You have to stand firm with your belief system and do always what's best for the students. Again, if everyone's on the same page,
Yeah.
and you have an administrator who's running a program where communication is paramount, then that's where these things move forward in a positive way. When you don't have communication and when you're rushing decisions or people, then that doesn't work the right way. And then that's problematic for the student. And it could have a huge impact for years to come, which that's not a good thing. It's not a good thing for the school because that's more services probably in the back end that you're going to need to provide. Why would you want to do that? You'd rather provide them into upfront deficits, try to fill those deficits, and move the
Yes.
student forward. But moving the student forward with these deficits still there will only mean more services, more services, more services, more services. If you step back and you look at it in this grade, in this way, and start filling these gaps here, they will
Yeah.
be more successful as they move forward because you filled some of the gaps at this time frame.
Oh, that's so
Beneficial
beautifully
to the
said.
school, but it's most beneficial to the student.
Yes, most beneficial to the student. There's this one case that I'm very close to with the family, and it started really early on. Dad did an observation, and I think it was like first grade. And he said that the teacher really made him believe that his son was the problem child, just didn't know how to listen, always misbehaving. And he feels bad now. ADHD showed first and then later on autism, because he said that he felt that he needed to hold the child back because he's like, my child's not listening, not following directions. Maybe he's not mature enough to go to the next year, but they kept on pushing him to go to the next year. But there was this one video that during the classroom observation he took, mom at the time couldn't come into the observation. So he took the video to show mom how their son was behaving. And he showed me the video. It breaks my heart because I only see him in the video. The rest of the class is here and he's in an isolated table facing the wall, but the instruction is over there. So all the kids are facing this way. He's facing the wall, but the teacher's there. He's only allowed to listen. And when he's trying to turn back, because he's not allowed to move his body back, but he's allowed to go like this with his neck, and the teacher would yell at him there, saying, "Oh, but you're supposed to be facing the wall."
Hmm.
But that makes the child think that there's something wrong with him, but there was no supports for him. At that time, dad didn't know about IEP. At that time, he didn't know about a 504. He just didn't know, but the teacher made him believe that his child was just a bad student.
That story resonates with me because going back to our earlier conversation, if they know you're a doctor, they know you're a lawyer, they know you're a plumber or a mechanic, once they know you're an educator, again, I would find that out ahead of time because I know who I'm talking to. I know that these are the conversations I'm going to be having. But it happened in my life with my nephew, and they kept telling mom and dad, he's doing this and this. He was in private school, and it's not doing that here at home.
Mm-hmm.
He's doing this, this, and this. And all these things kept coming. And I said to mom and dad, why don't you let me go in and I'll observe? That's what I do. And that's what I do for other kids. I can do it for him as long as he knows that he can't be waving to Uncle Michael in the back of the room and stuff like that. So I did. And I observed. Teacher wasn't happy with it. The school wasn't happy with it. But as I told mom and dad, you can request it and they need to do it. So I observed and I was watching what was happening. And it was not a point of, okay, I gotcha, but it was a point of, this is happening here because you're not doing that
Mm-hmm.
there. You are not addressing this student here when this situation is happening there. So when I sat down and I did it the right way, I took notes, I wrote it down, I gave it to the parents, and all pointed to the teacher who was in with more discussion, did not have a lot of experience with that grade level, did not have a lot of experience with behaviors happening in classrooms. It was more of a teacher management issue versus a kid issue. But it easily became, he's the problem, versus let's look at our internal system to see what's going on. So then stepping back,
Yeah.
as this whole discussion is framed from an administrator's perspective, once I hear that, then I walk in as an administrator and say, let me look at it. Let me
Mm-hmm.
sit there and see what's going on. And it could probably avoided all this stuff if I just walked in and sat down and saw the same things as I did and then could give feedback to the teacher. It's not negative feedback. It's working with the teacher to build their skill set to do a better job as a teacher. It's not a punitive thing. Oh, you're a bad teacher. You're not doing this. No. In this situation, maybe what could you have done different? I'm
Yeah.
curious. What could you have done different? Okay. In this situation,
Curious.
maybe if you did this, maybe if you moved chairs, maybe if you did this, but that was a real thing and it affected him. And he started getting in his head that he was the problem. And that's the problem.
Yes.
That's when you build a bigger issue when the student or the kid starts feeling, oh, I'm the problem because everyone's pointing
Exactly.
fingers at me. Lo and behold, you wouldn't know it, but I used to love to talk in class. The teachers used to call me Big Mouth. Okay. I can see that because I like to talk. Okay. So I've picked the right profession. But my dad would say, can't you stop talking so much? And it's like, but I have questions. They didn't like the questions because I was always
Mm.
asking questions. But why? How come? Why is the sky blue? All legitimate questions. But I got labeled a problem because I asked so many darn questions. And then my dad had to come in and say, he just likes to ask questions. He's not the problem. Keep moving. But yeah, that happened. And the teacher wasn't happy, but then they understood and they kind of reframed the whole thing and that problem dissipated. But it took a lot of energy to do for me to go in, do that. It should have been done by the school. It didn't have to be done by Uncle Michael. But if the other Uncle Michael wasn't an educator, then the kid's the problem. And that's where it would start moving forward into great. Guess what? You have Michael. He's a problem. Watch out. And that's how this stuff starts.
Yeah.
And it just moves forward. By the time they get into eighth grade, you don't want this kid. He's the worst. And that's how that reputation builds. Could have been
Yes.
stopped way back when.
I worry so much about their mental health. I really do. With this particular student, I'm constantly telling him because he's brilliant. I see him as brilliant. But all the years of teachers making him feel, trying not to get emotional, it's just because our kids are so fragile.
Sure.
They're so
And they
fragile and it
hear
just, they
and they
hear
listen.
and they sense it. Even if you may
Yes.
not say anything, if you give them a certain look, they sense that you don't like them. And in my head, I'm like, why are these people teachers to make our students feel so insignificant or not cared for? Or if he's even shared that he's even afraid of telling his parents because then their parents are going to be seen as that person because they're like, every single time I tell the parents, the teachers just get away with it. Like, oh, I just,
One of the things I used to do, which I'd love to do, is the start of each day, and buses would pull up. I would go out before the kids would start debusing, and I would go on each bus. We had tons of buses. And I would go on and I would jump in. Hey, welcome to Tuesday. Let's have a great day. How's everybody? You could start taking the temperature. And then once I got off that bus, I could radio and say, hey, Michael's having a little bit of an issue. Maybe we need a BCBA to go and talk or whatever. And you would start taking temperatures like that. And I
mm,
remember one day, and this was a 14-year-old, and I must not have been having a great day. We don't have great days sometimes,
hmm.
okay? Especially as a school administrator, everything could happen. Okay,
Yeah, yes.
you name it, it could happen. A parent could come in, you get a flat tire, you're late for work, you had an argument with your spouse or whatever, and you come in and here's my kid, I'm going. It happens.
Yes.
And so I must not have been having a good day. And I came off the bus and I went all through the buses and I was standing in front like I always did. And he came off and he comes right up to me and he goes, Mr. Michael, you talk about all the time that we need to start our day positive, and you came on the bus grumpy. That's not how you're supposed to do it. You need to change your attitude.
Aw.
I'm like, okay. And I'm like, you're absolutely right. Let's start all over. Made him get back on the bus, came back off. I'm like, how are you doing? Let's have a great day. He goes, that's more like it, Mr. Michael. Keep that up. And he walked past me.
I love that.
So they can sense it, they
That's so
feel
cool.
it, and it's okay to have a bad day. But sometimes you need to be clear with them and share. A lot of times when I was called, and a lot of times a preferred staff for some kids because they'd rather talk to me versus somebody else, and I'd go in and I would see them in a behavior or upset and try to get them to a point where they can have a discussion and try to get what they're dealing with and have it resonate with an experience in life that I had. And I always try to pull from stuff like that from my life to talk to them like, hey, I felt the same way. I'd be upset too, okay, if you were talked over by someone and your opinion wasn't listened to. But what do you do when that happens? You say, hey, Mr. Michael, you just talked over me. My opinion matters. Can you give me a chance to speak? Instead of a back and forth with a teacher and a kid. So I always try to pull something from my life to help the students see I've felt the same thing or I've
Me and
gone
you're
through
the
the same
same.
thing. Yes.
I
And
do
once
that.
they see
Yes.
that parallel, then that relationship starts building.
Mm.
And again, that's how you become a preferred staff because they sense that you understand them.
Yeah.
The minute they feel that you feel a certain way, they pick that up. And
Yes.
there's some kids over the years that just really punched my button sometimes. But I knew that. And in those instances, I would have to say, I'm sorry, we're going to have to work with you today. I'm going to back out because he was going to punch my buttons to the point where I would respond in not the right way. And I already knew that. So I had to back out and have someone else do it. You have to be cognizant of that
Mm.
as you're working with kids. And you
Yeah.
can't let that personal stuff, it all comes in sometimes. Okay. It all comes in. And when it does happen, it's okay. And I would tell, it's okay. We're all
Who's
human.
that preferred person?
Yes. But we're all human. You're having a
Yes.
horrible day. I get it. Step back, take 5. I'll step in. When you get back, you'll be better. Okay.
Mm-hmm.
That's all. As an administrator, if you're sitting in your office,
Love
you
how
don't
you knew
see
that.
that. You have to be walking around and see students. You have to know your students. You have to know what their disability is. You have to build these relationships within a school. The school, I just had 80 kids. I knew every kid. I knew every kid, every name, every parent, every diagnosis, everything. I read their BIPs. I knew what we had to do. That's what you have to do as an administrator.
Oh, you're
It's
such a
not
strong
rely on
administrator.
other people. You have to be the lead out front.
Yeah.
Okay.
I
That's what
remember,
leadership is.
yes, that's great. I remember when I was a middle school teacher, it was beautiful what you said. I really wish that all admins were like that because I can't exactly remember why he had to take over my classroom. I think I needed to go somewhere. I needed to do some training or something. And then he's like, don't worry, Miss Hoffman, I'm going to cover your class. And I'm like, oh, no, you're not. I was really nervous because I was like, this is the same person that told one of my students that if he doesn't do his homework, he's going to be a garbage trash
Oh,
person. I can't
gosh.
remember. He's like, do you want to be one of those? You want to carry out my trash? And I remember interrupting that conversation. Like, what's going on? He's like, oh, he just doesn't want to do his work. I was like, I can get him to do his work. It's okay. I got this. The way that he talked to my student, I remember I made sure that wasn't going to happen, but I don't remember how I did it, but I just felt my kids, again, the whole mental health. You can't just say that to students. You cannot say that.
Oh,
Oh, my goodness. So,
wrong. It depends on the student who you say it to. There may be repercussions when you say something like that. Again, schools are built on relationships.
yes, not all admins, though,
Administrators,
understand that.
unfortunately, Flor, in school, you can get an administrative license, but they don't teach you how to be an administrator. They teach you
Mm.
to follow a set of rules. If I was framing a program for folks who want to run schools, the first couple months would be based on how to build a successful relationship. Most people, adults, don't know how to do it. Okay. It becomes too emotional. They don't like having hard conversations. They say inappropriate things. They say things that just you would never say if you really sat and thought. It's like they say when you're angry at someone, write the email, but put it aside. Don't send it because if you send it, it has all your bad things, thoughts in it. It's the same thing.
What's your call?
but we can't process sometimes conversations. We have to get it out. So I have practiced the art of, I'll
Yeah.
get back to you. Because, because sometimes I'm like, I'm going to stop because if I say what I want to say, probably not be good. So I'm going to take 5. I'm going to come back and we can talk. But
Right.
administrators have to build a program based on relationships with kids, with parents, and with staff.
Staff. That's a lot of
All those
responsibility.
come into play. And those type of conversations, interactions with kids would never happen if you really knew the kid. Because you
Mhm.
know what? There's people who do pick your trash up, and that's a job, and that's a good job. Okay, and they get paid money for that. So telling someone that why would you want to be a successful part of a community? I don't understand why someone would say that. There's no
Yeah.
discrimination against what you do and what I do, whether you sit in an office or you work out and you're working on the streets out there shoveling, like all these guys shoveling out in my parking lot. Thank you. I appreciate you doing that. I don't have to do that because they get paid, but you know what? It's a kindness. It's a
Mhm.
relationship that you build. And that's what schools lack, building strong relationships.
Yeah. We can go so much further if the parents feel that we really are welcomed, that we really are part of the team.
Mhm.
Once that is felt, we'll go from
Sure,
there.
sure. And when you have to have those hard conversations, and sometimes I've had to have really hard conversations with parents, if you have a relationship that's built on trust, empathy, and respect, then when I have to come to you and say, Flor, we really need to talk about X. It's a hard conversation. It's going to be emotional, but we have to talk about it. We have to come to some decisions. Okay, then it's better for you and I because we already have that built, that
Trust.
trust and respect built, that you trust me that I'm going to be honest with you, and I trust you that you're going to respond to me in a way that's honest and respectful and things like that. If you don't have that, it's a problem. But if you have that, then those tough conversations, which happen every day with staff, with kids, with parents, it's better
Yeah.
if you have that framework built
It's
under.
easier too.
Yeah, it's
It's
easier.
comfortable for everybody.
Then there's none of this. You
Yeah.
can
No
alleviate a
one
lot
wants
of
to be
stuff.
there. No one
Yeah,
wants that.
you know what? As an administrator, you don't have time for this. You got to get payroll done. You got to get this done. You have to talk to MSTE. You have to talk to your boss. The parents have to go to work. The kids have to do this. You don't have time for this stuff.
None.
You have to make it an environment that it will have this sometimes, but you have to deal with it.
It's like
Hey,
family, right? They have this, and then they're like,
sure.
we love each other. We know we're on the same
You get
team.
annoyed at Sean sometimes, right? Okay, but there's a
Yeah.
way to say, "Hey, I'm annoyed at you." All right, or "Hey,
And
I don't like that decision you made," or
Mhm.
whatever. You just don't go in and go, "Boom." If you did, you guys would never talk. Same thing with teachers, kids,
Yeah.
and parents and administrators. But the main thing, a good leader in a school is walking the hallways, not sitting in an office.
Yes.
There's the key.
Exactly. Relationships.
You see what's happening, you can handle things. If you're sitting in your office and hearing anecdotal information, oh, this just happened, you
Yeah.
don't see it, you're responding to it then, you're reacting to it. But if you
I
see
love
it, you can just deal with it right there on the spot.
Yeah, I love small details. When teachers bring the smallest details or admin bring the smallest teachers that they've seen, I'm like, oh, you're observing. You do care.
Yeah. And observations don't have to be like I'm sitting here with a,
Oh,
with a
yeah.
pad of
It can be
paper.
something that they did in the
I would
playground
just
or outside.
I would do that, teachers like, hey, I was walking down the hallway. By the way, I saw this. Again, I'm just curious. Why did you decide to do it that way? Okay. If you start every conversation with that, I'm telling you, it leads into it
I'm
like
curious.
better. I'm just curious. Kids are curious. I'm curious.
I love that. Yes. Thank you for that input. As we wrap up today's conversation, I want to leave you with this reminder. Advocating for your child does not make you difficult. Asking questions does not make you the problem. And wanting data, transparency, and respect does not make you unreasonable. What Michael shared today reinforces something I say often. IEPs work best when families are treated as partners, not obstacles. If this episode resonated with you, please take a moment to like, comment, and share it. Your engagement helps this message reach other families who may still feel unheard. or alone. And if you're looking for deeper guidance, whether that's understanding retention, decisions, diploma versus certificate track, or preparing for difficult IEP conversations, visit us at startingwithiep.com to explore our courses, tools, and parent supports, which is designed to walk alongside you. You are not alone in this journey. Your voice really does matter, and your child deserves a team that sees their potential, not just their paperwork. Thank you for being here, and I'll see you in the next episode of Starting with IEP, which, by the way, the next episode is actually the continuation of this episode because we just kept on talking, and there was a part 2 actually. So the episode could have been like 2 hours long. So I just cut it for it to be part 1 and part 2. So stay tuned for part 2. It just gets better. Bye.